As a healthcare professional, you should be well versed in the community resources available to your patients. If you care for women or children, please listen closely to find out what the WIC program from the U.S. Department of Agriculture can offer your patients and your community. Initiated in 1974, the Supplemental Nutrition for Women, Infants, and Children program, or WIC, serves to improve the health and wellness of millions of women and children across the United States. WIC is available in all 50 states as well as most U.S. territories and tribal reservations. The program provides healthy food, education, and other support services to at-risk families. Many WIC services and programs vary by state. For this reason, we'll focus on WIC in Texas today. Patients may qualify for WIC based on need, as well as a few other criteria. A WIC client must be a resident of Texas and have an income less than 185% of the federal poverty level. She may also qualify if she or a family member already receives state welfare services such as SNAP, the Supplemental Nutrition Assistance Program formerly known as food stamps, TANF, the Temporary Assistance for Needy Families, or Medicaid. Additionally, she must demonstrate nutrition risk. This may be a medical risk such as anemia, under or overweight status, a history of pregnancy complications, or poor pregnancy outcomes. Her risk may also be based on failure to meet dietary guidelines for healthy Americans. This final category is broad and helps the program to capture families who might make too much money to qualify for welfare, but may still be at risk of poor nutrition. The primary benefit of WIC to your patients is improved access to nutritious foods and, in effect, improved overall health. The program allows families to purchase healthy foods that they might not be able to afford otherwise. WIC food selections are based on the published dietary guidelines for healthy Americans, and the program has been a success since its inception. It's widely considered to be one of the greatest public health interventions in U.S. history. If a patient of yours qualifies for WIC, she uses these benefits at the grocery store as she's buying whatever she needs to feed her family each month. Set amounts of nutrient-dense foods are added to her electronic benefit transfer card each month so that the USDA can reimburse the store for what she purchases using WIC. These foods include fresh fruits and vegetables, whole grain breads and cereals, eggs, cheese, peanut butter, and other wholesome, nutritious foods. A second benefit of WIC enrollment for your patients is nutrition education. While you may not have the time to make sure all the mothers in your practice are up to speed on how to make a nutritious meal, or that they understand how macronutrients affect their bodies, WIC is well equipped to do so. Much of this education is delivered online through learning modules customized for the client's knowledge level. In-person classes are also available. Patients receive education on serving sizes, how to build a balanced diet, what children need to grow up healthy, and a variety of healthy recipes to make with the foods they get from WIC. A third and very important WIC benefit is education and support surrounding breastfeeding. Years of scientific evidence have demonstrated that human breast milk is the most appropriate nutrition for human babies during the first year of life. WIC empowers women to breastfeed successfully by offering loaner breast pumps to establish adequate milk supply, and even giving portable breast pumps to mothers who need to return to work or school. They also offer direct lactation support in a network of peer counselors ready to help women with the challenges of breastfeeding. WIC also has international board-certified lactation consultants on staff at many clinics and operates several lactation support centers in major metropolitan areas across Texas. To incentivize breastfeeding, WIC offers additional food benefits to mothers who are breastfeeding exclusively. As you can see, the difference in food benefits is substantial and may serve as just the push your patient needs to really give breastfeeding her best shot. While WIC does assist women in purchasing formula, it's not adequate for an entire month of meals for baby. The formula vendor contracted with WIC in the state of Texas is Similac. Similac Advanced Formula is available to all WIC clients who are formula feeding. If one of your patients needs a different formula due to an allergy or other medical condition, WIC will require a note from you in order to issue benefits for that specific type of formula. These forms can be found online on the WIC Texas website. The Supplemental Nutrition for Women, Infants, and Children program is a tried and true, effective, comprehensive, and well-organized public health program for your patients. So what should you do to make sure your patients make the most of the resources available to them? Start by knowing the location and contact information of the WIC offices in your area so that you can easily point patients towards services. Be familiar with what it takes to qualify and the food plans available to your patients. Utilize the breastfeeding support resources and materials offered by WIC. They have a number of well-designed educational materials that you can have available for your patients at your office. Studies show that encouragement from a healthcare provider can increase breastfeeding rates in postpartum women by up to 11-fold. One such breastfeeding resource available to you is the Healthcare Provider's Guide to Breastfeeding, a smartphone application available through WIC that's designed to help you navigate the challenges of breastfeeding with any of your patients. Most of all, be observant and aware of the psychosocial and environmental needs of your patients. Encourage families to utilize resources, removing any stigma surrounding using public assistance. An effective partnership between a patient, her doctor, and her WIC clinic is a powerful tool for health and wellness of families in your community.